We are going to start on time. The first surgery is going to be by Dr. Ajay Agarwal, and we are going to be demonstrating squint surgery. We have on the other side Dr. Mansi, who is coordinating from Vivekananda Netralaya. So, Dr. Mansi, can you please briefly tell us about the procedure and the case, and can we start the surgery on time, please? Thank you.
Thank you, Dr. Vardhaman. I hope people can hear me there.
Yes, very clearly.
Okay, good. So, good morning, everyone. It is my immense pleasure and pride to welcome you all for the midterm conference AIOS 2024 being held at Dehradun. I am Dr. Mansi Gusai Pokhriyal, Medical Superintendent Vivekananda Netralaya. I would like to thank all the AIOS committee and Honorable Chairperson, Scientific Committee, Dr. Namrata Sharma ma'am, for giving us this opportunity to host this live surgery. And special thanks to Dr. Gaurav Luthra to support us. So to begin with, first surgery, we have a squint surgery by the renowned Dr. Ajay Agarwal. Sir did his MBBS and MS from MAMC and GNEC in 1992 and did a registrarship from GNEC in 92-95. He was a director of Banarsi Das Chandiwala Eye Institute from 1995-2003 and among the first one to start a LASIK in Delhi. He headed the squint department at Shroff Eye Center, Kailash Colony until 2016 and is running his own center under the name of Dr. A.K. Agarwal Lasertech Eye Center, Kalkaji, New Delhi. So to talk about the case, we are presenting a case of a 32-year-old male resident of Dehradun, Uttarakhand, who came with the OPD complaint. Okay, this is, where is the other? This is the case. So we are presenting, sorry for that, we are presenting a case of exotropia. He's a 35-year-old male who complained of outward deviation of right eye and with history of cataract surgery done in the right eye 15 years back following trauma to his eye. So vision in the right eye is 6.9 and gets corrected to 6.6 with a correction of 0.5 spherical with minus 0.75 cylindrical at 80 degrees. His anterior segment findings are within normal limits with pseudo.
Dr. Mansi, we are not able to hear you. We just lost your audio. Video is also frozen, I think. Okay. Seems to be a glitch.
This is the entire length exposed of the lateral rectus. I've given one stay suture, 60 vicryl on the one end of the lateral rectus muscle. Then I'm giving the second stay suture, one half width, one full width. This is full width. I'll just lock it while taking out the suture. This is locked. Okay. Scissor. So I've locked both the end. I'll just cut it. I'm planning to do a 6 millimeter recession of the lateral rectus. This is lateral rectus muscle is detached. 6 millimeter. मार्कर लगा लेना कैलिपर. So from the insertion I am taking the 6 millimeter. This is the needle holder. So I'll just pass through this scleral bite. I'll take this one firm and wide. Visible track is visible through the sclera. So this is secure enough. one cut end is short of the suture just to identify whether it's a lower end or the upper end. Now I'll pass another bite, the other end of the lateral rectus through same to the sclera visible, the track is visible, sufficiently wide, firm. Now I'll take 2 loops just to tie this suture. One end is secured, the other end है ना, जो निडल लोडर होगा ना, इसका टिप को थोड़ा भिगो लेना बाद में ना, इससे ब्लड लग जाता है, उसमें ना सूचर अटकता है. तो आई जस्ट कट द एंड, ये रख ले, संभाल कर रखना इसको, हो गया तो फिर दूसरा लेना. विल कट द अदर एंड ऑल्सो. I'll use the same 60 vehicle to close the needle holder. As is a post-traumatic case followed by cataract surgery, the conjunctiva is very thin. This is the mark, blue mark, which I have initially placed just to identify the cut ends of the conjunctiva. Just take 2 loops and this is drag. सीजर ले ले बेटा, इसको काट दे मेरे उसके ऊपर से, सूचर काट दे. Good. Now I'll suture the other end. मेरा चश्मा ले ले बेटा एक बार थोड़ा, मैं ताकि मैं दूसरा एंड सूचर देख लूँ एक बार. I'm just closing the conjunctiva now. Just closing the conjunctiva. I'll cut the long ends later on. Yes. So this is the middle, the lateral rectus which has been done. हटा ले. हटा हटा. मेरी चेयर इधर ले ले. So now I am shifting towards the.
I think it's amazing surgery, sir. So quick. Now we are to the other muscle.
So we are also joined by Professor Dr. Nahid Akhtar, madam, and Dr. Bhalla sir in the panel. And if any of you want to ask any questions along the way, please.
So this is चश्मा निकाल ले बेटा मेरा. ले. Good. So this is the medial rectus which has been. Caesar.
Dr. Ajay Agarwal sir, that was a wonderful surgery you did on lateral rectus muscle and very neat and clean. But just one question, whether you go for 60 Vicryl for conjunctival sutures in all cases or you go for
No,
80?
I'll go in all cases. I don't open the catgut or any other suture because it serves my purpose and I'm using it for so many years. I'm very satisfied. Normally, I've seen after 10 days, it automatically falls off. It is not required to be taken out. And if at all in adults, if it is persistent causing redness, then I take out the suture after 2 weeks on the slit lamp itself.
No, that is Vicryl 60 for all cases, huh? For conjunctiva.
Yeah. Yes, yes. That says my time also and that says my sutures also.
Okay.
Because already open, why to use catgut causes more inflammation. And I don't like catgut using on the conjunctiva. So this is the lateral rectus. Sorry. I'll just use a swab stick just to show you the entire length of the lateral rectus. As we can see, 4 millimeter le le beta. The technique of the resection is slightly different in my case because I use only 160 vicryl, only 160 vicryl for recession as well as for resection. The same suture I'll use for the resection also because of my technique of passing the suture is slightly different in the resection which nobody uses. I'll just show you. So the एक दूसरा वो ले ले muscle hook. I'll use the second muscle hook just to lift the muscle so that ये पकड़ ले बेटा, थोड़ा उठाकर पकड़ना, मुझे suture दे दे, थोड़ा सा कोने में रखना. The muscle has been lifted from the scleral side, so I can pass the suture safely now at the mark. One suture here, one bite. Second bite is slightly through the the muscle valley. Now it has been logged automatically. इस वाले को पकड़ ले बेटा जो मेरे हाथ में हाँ बस बस. I'll just for the safety reason I'll give two so that it doesn't slip because it's a resected muscle. You'll have to put this muscle under tension. So I'll just secure it one end. दूसरा suture end दे दे बेटा. So I'm waiting for the other side suture. This is the other side suture which I almost half muscle width. Now the end is visible to me that this half muscle thickness. This muscle is मुझे पकड़ ले बेटा. This I'll just because I'll have to tie it because it's a resection. The muscle is under the tension. The sutures might give way sometime. I've just secured it with a knot, which I don't do it in the recession because the muscle is under relaxed state. Scissor de beta. Now I'll just cut it. This under supervision. This and this. I'll just cut it this end also. The residual, the section I am doing is around 4 millimeter. Little older. एक मिनट सूचर मत घुमा मिक्स हो जाएंगे सूचर. So I'll take this one end of this. Keep shut up.
नहीं, afternoon only, ma'am said, because it is sponsored now, we can't change the timing. Yeah.
This was the original site of insertion. I'll just pass through with the sclera. I pass through the middle of this stump of the muscle. The other end I will pass through this. The same suture. I use one arm only for the resection also. Now this has been passed from the other end. This is my cut end. So one end is secured. Now I'll do the same thing at the upper end of the muscle. इसके में तेरा उसमें है यार, तेरे इसमें अंदर मसल सूचर के साथ मत पंगा करना. I'll just release the traction now because I have to tie the suture.
वैसे तो 8:45 तक खत्म हो जाना चाहिए था ये. It is already. Yeah.
The muscle has been pulled. Now I'll take the second. This also and this has come. The press ऊपर जरा swap कर दे. जरा जहाँ my muscle, I'll just show the stump. No, yeah. So the entire muscle has come. This you can see. Yeah, this is the. So one can see this is the resected muscle which has been attached, reattached. I'll just. ये ले, इधर रख. I have now enough suture left which I can use for the second eye also if I want for the second case. So normally I don't waste my sutures, but it is not needed actually.
Focus, camera, focus.
Okay.
Centration. Centration.
किस तरफ? मसल की तरफ?
Left की तरफ, हाँ muscle की तरफ. ठीक है.
So this is the conjunctiva. This is the mark which is visible now. So I'll reattach it. So surgery is done. Basically, I'm just closing the conjunctiva.
It was a very neat and very beautiful surgery, Dr. Agarwal. Thank you so much
Thank
for
you.
the demonstration. If Professor Akhtar ma'am wants to ask any particular questions about this.
Uh, Dr. Ajay, it was a wonderful surgery. You have performed very neatly and very precisely. Just one question that
Yeah.
do you advocate going for adjustable sutures in case of traumatic cases?
For adjustable sutures, they are advisable where the chances of the undercorrection of the overcorrection, they are more like in the thyroid ophthalmopathy or in the resurgeries you can, but normally I prefer to do non-adjustable sutures. Like most of the cases they are under GA, so it's difficult to do the adjustment under the GA. So I prefer the non-adjustable surgery, but in some cases where the outcome is unpredictable, I have tried in few cases, but I'm more or less, with age I have more or less gained this experience to do almost, I get my desired result with the single surgery only, mostly. I'll just release my this thing which I put initially, section suture, this silk.
Dr. Bhalla, this side, Dr. Ajay, very
Hi,
neat.
Dr.
neat.
Bhalla, good morning.
Good morning, sir. Very neat and clean surgery. You always make the limbal conjunctival incision because
I
see-
know just because the 15 minutes were given and I just can't make
Okay.
the fornicial incision. Fornicial incision takes time. And limbal incision, the most, it's easiest to make. The exposure is good. You can simultaneously do the conjunctival recession also. And if you are planning to do a upshift or the downshift, then it is the most suitable thing for limbal incision.
Yeah.
And
Thank you, sir.
Thank you.
for resurgery also it is good.
Yeah. Thank you,
You
Dr.
can see
Agarwal, sir.
almost, it has almost come in the center after doing this section.
Exactly,
Yes.
sir. Thank you,
Beautiful,
sir.
beautiful.
Now we'll be shifting to the next second
Surgery
surgery.
is over. I hope didn't take much time.
Yes.
Not at all,
Thank
sir.
you.
Thank you.